Today's episode is about something that I'm very passionate about. Obviously, I'm passionate about scoliosis, but one of my bigger passions and sometimes pet peeves is when physicians and those related to scoliosis treatment don't give patients the option of what they can do. In this episode, this is a hot and cold ones episode, and you may have heard one of these from us before, but I'm in a sauna and I will go into a cold plunge during the episode to keep it kind of interesting. You'll hear my voice change as I go into a 45-degree cold plunge. But the purpose of this episode is to kind of shed a little bit of light on how scoliosis is treated and referred. And I'm very passionate about this. This is something that kind of gets me fired up with giving patients the choice of what to do. I think there's plenty of evidence for scoliosis-specific exercise like the Schroth method, plenty of evidence for treating conservatively, and they should be given the option of doing that. So I won't go on my rant right now. I'll leave that for the hot and cold ones episode. We also did this on YouTube Live, so this is just live and was recorded live, so it's not scripted. It was just talking. So I hope you enjoy it. If you have any questions, leave those in the comments. And here's our hot and cold ones episode on provider referrals. All right, on today's YouTube Live, hot and cold ones, we're trying to do these every week, so on different topics. And today it's just going to be me solo. I have a little topic that I want to discuss. We're going green in the sauna today instead of the regular red, but today I'm going to put my phone out of the sauna because today we are going to do a steam sauna. So the stove is all ready to go. We're steaming. We're getting pretty warm in here. Oh man, that's a lot. Let's do one more. And today, because hot and cold ones today is going to be, oh, it's a little hard to breathe. Hot and cold ones today is going to be a little more specific about something I'm very passionate about. I'm very passionate about scoliosis treatment, and in the past couple of weeks, I've actually had some discussions with some providers that made me want to really get into giving patients the option of what to do in treatment. This is a soapbox of mine. It's a passion of mine, and I want to really get, I guess, not deep into this, but I want to share my thoughts and my feelings on this. Let's do a timer so I'm not in here forever. Oh, that's not working. There we go. So we're gonna go like 5 minutes in here, and then we will go into the cold plunge. But so make sure that I don't know if these microphones are going to last with this amount of humidity, but we'll see. So I need a little more here. Okay. Woo, man. Okay, so one of my soapboxes is that we shouldn't do the wait and see approach for scoliosis treatment. Scoliosis treatment is something that requires multidisciplines to address, and so I feel like to get the best results with scoliosis treatment, we need to have a multidisciplinary approach. Unfortunately, there are a lot of providers who have more of a wait and see approach, an approach where it's let's wait and see if the curve gets worse. So if this sounds like you, if this sounds like something you've been told in the past, that you should wait and see if your scoliosis curve gets worse, I am not for that. Let's say you had an 8-degree scoliosis curve. That scoliosis curve, you could probably wait and see if it gets worse. But anything that we're really that's really scoliosis and really is something that we need to address should not have a wait and see approach. And it's interesting in this sauna, it's a little harder to keep my thoughts straight. But we should be proactively treating scoliosis. Obviously, I'm a little biased. I'm a scoliosis specialist. I see scoliosis all day long. And because of that, I feel like scoliosis should be treated in a certain way. And that's not just because I'm biased to treating scoliosis. It's because the research supports that. The research supports that doing things early does benefit benefit the patient. And so a lot of times what I'll see is people talking about providers talking about scoliosis treatment as either let's wait and see if it gets worse, or there isn't anything that has been shown to be effective with this. That's the thing that really got me this last week. I talked to a few providers, some surgeons and some other types of providers, and that thought is pervasive in medicine that, oh, there's nothing that can be done for scoliosis, so you should just wait until you're a surgical candidate. Some have picked up on adolescent bracing as something that is effective, and that can be and it can be very effective, and there were some studies that came out that showed that, and then people started to get more on board with bracing. There was one study called the BRACED study, BRIAST study, not braced like you're braced. And it showed that there was a lot of benefit for bracing. And so after we had the BRACE study come out, all of a sudden, some of the orthopedic doctors jumped on bracing as something that they would do, where especially here in Utah, there wasn't a huge consensus on whether we should use bracing or not before that. So, so at this point, I'm talking to providers about sending patients for scoliosis-specific exercise. And I'm hearing things like, well, there's not enough research to support this, or studies aren't showing that it's actually effective, which is totally untrue. We have plenty of randomized controlled trials to show that it is effective. We have anecdotal evidence, we have case studies, we have all kinds of things that are like showing that this is an effective treatment. And so when they say that, I struggle because I don't see that is true, especially in what we see in the research right now. And so recently I heard a surgeon that said, there was a study that showed that there was no difference when doing Schroth training compared to when not doing Schroth training. So why would I send for this? And I don't know exactly what kind of literature review he's doing, but there might be one or two, maybe 3 studies that are showing no significant difference with Schroth training. But overall, there are plenty of studies, and you can go to our website. We have a page on our website that talks about scoliosis research, and you can go on there and see what I'm talking about. There is plenty of research showing that the Schroth method, or scoliosis-specific exercise, is effective in treating scoliosis. And so I think what he's doing is he's kind of using that as an excuse not to refer people for scoliosis-specific exercise. So my biggest soapbox is, if you're a provider, please give all of the options to your patients. So say you treat adolescent scoliosis or scoliosis in pediatrics, and I have 15 seconds before I have to go in there. What I would request is that you at least tell them that there are options to treat scoliosis conservatively. All right, so there is 6 minutes in the sauna. And now we're gonna, let's see if I can do this. Okay, we're gonna do 3 minutes, and this is at 45 degrees. So I dropped the temperature a little bit. Oh, I can tell I dropped the temperature on that. So, where were we? We were talking about, this is really hard to think. So, what are we talking about? Giving people the option. Giving people the option of other treatment techniques to do. So, when I was, oh my, when I was talking to that surgeon, one thing that was interesting is he kind of showed his cards a little bit, where he said, because I said, what? Oh, this is so cold. He said that, hold on. He said that it's hard enough to get kids to wear a brace. Did I start the timer? It's hard enough to get kids to wear a brace, so why would we ask them to do more? And when we know that they're not going to do it. This is something that I really have an issue with, because why are we deciding as providers what patients will and won't do? We should be giving them the option of those things that are possibly effective for their scoliosis. Even if we don't necessarily believe completely in it, we should be giving them options that are supported in the research. I'm not saying that we should suggest everything under the sun. That's not at all what I'm saying. I'm not saying that we should tell them some crazy thing that hasn't been researched and is energy work or something like that that we heard or saw on YouTube that has no research to back it. That's not what I'm saying at all. I'm saying that in the literature, if we have support for something, especially for something that normally is told to just wait and see if it gets worse, that we should be offering that up as a possible help and a possible support to their treatment. So, I'm getting the tinglies now. Okay, we're going. So that's really all I ask, is that providers give the option of doing something instead of nothing for their scoliosis curve. Because what I see a lot of times, bracing is caught on, I think, with the orthopedic population. And so that is something that they're suggesting and they're encouraging people to do when curves get to 25 degrees. But I'm not seeing the standard of care including scoliosis-specific exercise, which I think it should, because there is enough support and enough evidence to do that. And it's sad, because I do have patients all the time who come in and I ask them how they heard about us, and they'll say they heard about us through YouTube. And that's great. I mean, seeing us on YouTube is great, and researching us online and seeing that is great. Oh, let's see, almost there. But it would be better if the physician that they saw had talked to them about that. Okay, so there's my 3 minutes. Oh goodness. Whew. That was so cold. So the saddest thing that I see, let me get back in here, it's a little quieter. The saddest thing I see is when I see someone come in for treatment. We need a little more steam here. I see someone come in for treatment and they have seen physicians or surgeons that I've talked to multiple times about scoliosis-specific exercise, and they weren't told anything about that, or that is even a possibility. That's sad to me. I've had that happen way more often in my career than it should, and it makes me wonder why aren't those physicians giving scoliosis specific exercise as an option for treatment. And I don't know, maybe it's just they don't believe in it. Maybe they don't think that it's effective. Maybe they haven't read the research, because there's plenty of research to show that it is effective when done correctly. Maybe they don't think that patients will actually do the exercises. Maybe they don't want to burden the patients with scoliosis specific exercise when they're struggling to wear a brace. Maybe that's a real thing. And I mean, there are plenty of reasons for this, but they should be giving them the available options. You know, if you're at 25 degrees, we're going to brace. We are also going to add scoliosis specific exercise, because the combination of the two has been shown to be more effective than either one by themselves. A curve that's at 20 degrees and has progressed, why not tell them about scoliosis specific exercise so we don't get to the point where we need a brace? There's been research to support that as well. I think the plan of care definitely can include these things. I forgot to set a timer. I left my timer out there. We can it definitely include these things, but the patients need to know about them. Some patients will go home and they will research online and find us online, find us on YouTube, find us on our blog, find us on our website, things like that. And that's great that they're finding us that way. But what about those that take what the physician says as the gospel truth and never look into anything else when it could be helpful? Yesterday we had a patient that came into the clinic that had started out at 42 degrees. So a 42-degree curve, just so you know, that's very close to surgical intervention. We need a little more steam here. Very close to surgical intervention. And so you would think that we would want to do everything we could to stop that curve from progressing. So she said that her, whew, that's steamy. She said that her physician recommended a brace, so she has a brace, and that's great. That's totally appropriate. But when they asked about conservative and doing exercise, he said, well, there's no research to support that. And so they left, and luckily the daughter and the mom both didn't want that to be the answer, and so they researched online. They found the Schroth method. They looked up who does the Schroth method in Utah, and we came up, and so they came in, and we've been working with them for about, I don't know, 6 to 9 months, I think. And that curve, that 42-degree curve on the last out-of-brace x-ray was at 34 degrees, I think, which pulls her down out of the risk of surgery. She's not out of the woods because she's still growing like a weed, but it definitely improved the symmetry. They noticed that her shoulder blades are more symmetrical. They noticed that her posture's better, and we're noticing less angle of trunk rotation that we measure on people's backs. We're noticing that she's doing fantastic, but she is committed because she looked it up and she decided, this is what I want to do. And huge props for her on that, because she took advantage of the internet to figure out what she was going to do. Now, if they hadn't done that and they had gone with what their surgeon said, oh, there's not enough research to support this, that 42-degree curve, she's grown probably 2 inches over that time. That 42-degree curve almost 100% would have progressed. I don't think many people would say that wouldn't have progressed. That's a progressive curve, and that would have progressed. To have it go down to 34 degrees, I mean, you can only blame bracing and scoliosis-specific exercise for that reduction. And I think that's a key point, that doing something is usually better than doing nothing, especially doing something that has been shown to have benefits. even though it may not and hasn't been shown to have adverse effects. We don't have adverse effects with scoliosis specific exercise. We have patients who are increasing in strength. We have patients who have an increase in their posture. We have an increase in body awareness. We have an increase in awareness of what their scoliosis curve is doing. We have all these good things. So why limit who we use that with? Because those are all very positive things. One thing that I see a lot is physicians that will diagnose someone with scoliosis that, I have 30 seconds left, diagnosed patients with scoliosis that will use physical therapy, general physical therapy, as a conservative treatment. The research does not support that. The research does not support that conservative conservative general physical therapy does not affect the curve trajectory. So that's let's chat more about that as we get into the cold plunge for the second time. This chiller's a little loud, so I'm going to turn that off. Maybe. So when someone is referred, that is so cold. When someone's referred, I'm going to set a timer though this time. I don't know how to start that. Oh, there we go. Okay. 1, 2, 3. There we go. Okay. 3 minutes. When someone's referred for general physical therapy for scoliosis, one thing that you have to remember, the research is done on scoliosis-specific exercise. And scoliosis, I'm going to go a little deeper. And the research shows that scoliosis-specific exercise can be helpful in reducing progression of the curve and stabilizing the curve, and sometimes even reducing the curve itself. But that's scoliosis-specific exercise. Things like the Schroth method, the C's approach, the Lion method, the side shift, things like that have actually been researched. When someone's sent for general physical therapy, usually, and I'm a physical therapist, so I can attest to this, usually they are seen for strengthening of their core. I was a general orthopedic specialist for 9 years. Every time I move in here, it gets colder. I was a general orthopedic specialist for 9 years, and if a scoliosis patient came into my clinic, what I would do is I would strengthen their core and work on postural muscle strengthening. While that's not a bad thing, it hasn't been shown to change the trajectory of the curve at all. So that's something that's very important to remember. If you have a child with scoliosis, or you're an adult with scoliosis, and you have been told to do physical therapy, and you've been referred to a general physical therapist, recognize that they don't have the training to treat scoliosis specifically. And I think that's really an important point, that the exercises that they're doing are either, maybe they're exercises they've seen me do on YouTube, or they're thinking about postural control and working on core strength, which isn't what you need. You need exercises that are tailored and specific to your scoliosis curve. I think that's a huge takeaway that I want anyone watching this to take away, is make sure if you're being treated in physical therapy by a physical therapist that they're doing an actual method for scoliosis. If they're not doing an actual method for scoliosis, I would look for someone who does, that is trained and certified and knows what they're doing with scoliosis treatment, because you want your effort to translate to an effect on your scoliosis curve. And you can't guarantee that if it's just core strengthening. Ooh, 2 seconds. Let's see if this... Oh, the timer does beep. Oh. Okay. So, scoliosis-specific exercise takes a decent amount of work, and it takes a decent amount of time. If someone is an adolescent with scoliosis, and they're growing, they're actively growing, they don't have a ton of time to mess around with finding the treatments that might be right for them. They don't have a lot of time to just do core strengthening. We're gonna put some... Ooh, baby. Time is of the essence if they're growing. So doing general physical therapy exercises, that can be great if you have some back pain and want to work with that. But again, I reiterate, if you're looking to do treatment for your scoliosis, make sure you're using a method for your scoliosis. So I don't know. I kind of lost my train of thought going from cold plunge to sauna today. But a little bit of a rant. Patients, look for scoliosis-specific exercise and make sure that that's being done if you're wanting your scoliosis treated. Providers, please give patients the option. Don't assume that they know the options. Don't wait for them to ask for the options. If someone was progressing and they were at 25 degrees, most orthopedic docs would send them for a brace. Why aren't we doing that with scoliosis-specific exercise, with the Schroth method specifically? It has been shown to be effective. It has been shown to improve outcomes with scoliosis. Why are we blind to this? I don't understand it. And why should a provider be choosing for the patient what they are willing to do? I see this with cost. I see this with travel. I see this with effort, that a provider will say, oh, it's too far. They live, 20 minutes away from that clinic. I don't want them to have to travel to do that. Or financially, I don't want them to have to pay for that when maybe I'm the one that's uncertain about whether it's effective or not. Or I don't think that they'll do it because they don't have the discipline to do it. Providers, who are you to decide that for your patients? If something has been supported in the literature, give them the option. And I don't think this is just with scoliosis treatment. I think this is with many other things with medicine as well. We should be giving patients the option of what they want to do. And yes, make recommendation on what you feel is appropriate and what is the best course of action, but don't hide those other things from them that could be effective and that they might be really able to see benefits from. I'm kind of tired of seeing this in the clinic. I'm seeing this still, even though I have talked to so many providers and so much education on this, and it's still happening. It's still happening that patients will find us online and then they're irritated or upset with their physician that they didn't tell them about it. So if that sounds like you, if you found Schroth method or other methods online and you're seeing good results with that, and your surgeon that you had gone to didn't tell you about that, let them know in your next appointment. Tell them that, hey, I had to look this up online. Why didn't you tell me about this? And I think that's an important conversation to have. We here in Utah, we do have some great surgeons. We have some great surgeons that are supportive of what we do for scoliosis specific exercise. But on that same note, we also have some surgeons and other providers who aren't supportive, that tell patients that it's not supported in the literature, or don't even give them the option of something conservative and say, wait and see if it gets worse. And I think that's doing a disservice to our patients. And I think, and that is something that we should not be deciding for our patients. We should let them decide what they want to do. Here at Align Therapy, we do that a lot, where we're allowing our patients to decide if they want to. We give them choices on how aggressive to treat their scoliosis, and I think it's important to give people choices, especially in healthcare, because that I don't think people are used to doing that in healthcare, having those choices. But I think that needs to change. We did have, if you look at our blogs, I did a blog post recently where I did a podcast episode with a patient that the audio didn't work out so well, so I had it transcribed, and so you can read that podcast episode. That's with a patient named Carolyn, and Carolyn brought up a point. I don't think this happens very much, but she felt like the surgeon that she was going to was just kind of leading her along until her surgery got not her surgery until her scoliosis got to the point of needing surgery. That he wanted to do surgery on her and thought that she would get to surgery range anyway, so he didn't recommend anything conservatively to do for her scoliosis. And she had a lot of mistrust in the medical profession because of that. She felt like she was just told to wait and see until it got to the point of needing surgery. And that's a sad story if that actually is true, that someone would withhold treatment just to do surgery. I don't think that's the case with the majority of our surgeons and our physicians. I'm sure it might happen out in the world, but I'd like to think that they have patients' best interest at heart. So if they have patients' best interest at heart, they should be recommending those things that have been shown to be effective. So it goes back to give the patients the choice. Make sure it's something that you can see some support for, but give patients the choice. They deserve that. That's why they're coming to you, is to know what's going on. They're not coming to you for surgery. If you're a surgeon, they're coming to you to avoid surgery if possible. And I do feel like the Schroth method and the SEAS approach and the ways that we use those here at Align Therapy are effective in helping stop that progression. So I think that's the end of my rant. I am pretty much done with this sauna cold plunge experience. It was actually really good. The that 45 degrees on that first one, whew, that was cold. But I really like the steam sauna, which is something we haven't done on this. It's a little harder to talk once that steam hits my face, but I think overall it's a good experience. So key takeaway: give patients the choice if you're a provider. If you are a patient, make sure that you have looked into the options available and are doing something scoliosis specific. So I appreciate you watching or listening to this in the future. If you have any comments, leave those in the comments below and I'll definitely answer those. But I appreciate you being with me on this journey of a hot and cold ones experience at Align Therapy. We'll see you next time.